morning. Those born with heart defects need specialized lifelong follow-up care. They need someone who understands the impact of a congenital heart defect, which is different from the impact of developing heart problems as an adult. So here to tell us more about the importance of continuing care for adults with congenital heart disease and expertise available is Dr. Stephen Cook, Director of the Adult Congenital Heart Program at Helen DeVos Children's Hospital. Good morning. Thanks so much for being here with us.
Good morning. Thanks for having me.
Absolutely. All right. So first of all, I think people need to understand what is congenital heart disease.
So congenital heart disease is an abnormality of either the walls or the valves of the heart and even the great vessels. It could be either one or involving all three of those abnormalities at the same time.
Sure.
Congenital heart disease is actually the most common birth defect in children. It can affect as many as about 1 in 100 live births per year.
Sure.
Babies are born with congenital heart disease. And so it's interesting in that despite these large numbers of children born each year, there's been huge advances in medical, transcatheter, and surgical therapies decreasing the mortality in these children. And we can now say to children who are born with congenital heart disease that greater than 90% of these patients are now expected to live to adulthood.
Phenomenal.
So it's amazing now that we can estimate that there are now 1.4 million adults living in the United States alone with complex forms of congenital heart disease, a number that's now, there are more adults living with congenital heart disease than children with congenital heart disease in the United States.
Wow, and that's the reality of it all.
Yes.
So many people. But sure, they get so much focus on them when they're younger, but this is something they have their entire life. So as adults, how do you go about continuing their care? Why is that so important?
It is important. I think that, we have to remind our patients that they do require lifelong care. I think many of our patients have undergone their previous surgeries as either a newborn, a child, or a teenager, and many of our patients think that they're either fixed or cured. But we have to remind our patients that they're repaired. So as an adult congenital specialist, it's really important for us to remind our patients, or us to remind that we need to think about getting their medical interventions, knowing their prior history, and to really look for expected complications. But as an adult congenital specialist, it's important to really expect the unexpected as well. So I think it's important to have a partnership between the adult congenital specialist and the patient themselves to really give them the quality of life that they deserve.
I was going to say, are they receiving this care? Are they aware that they should be receiving this care? Or some of them kind of put it in, oh, that happened to me a long time ago.
Yeah.
So, and you guys have a team in place for all of this, right?
Yeah, we do have a medical team of adult congenital specialists, but I think one of the most staggering facts is that less than 10% of adult congenital patients are actually followed in an adult congenital specialty clinic.
Wow.
And I think that, again, stems from the fact that many of our patients, I like to call it, they think that they're in a honeymoon period.
Okay.
They're asymptomatic. They think that they're doing well. And these are patients who are in their second and third decade of life, in their 20s and 30s. So you think, why should I even see a cardiologist, never mind an adult congenital cardiologist? I think that many of our patients don't even know that adult congenital clinics exist. And as you can imagine, as we hit 24, 25, 26, a lot of our patients are on their parents' insurance, they're losing insurance, and they can't afford to come back to a medical clinic because of the high cost sometimes of medical practice. So we have to really reach out to our patients and remind them that they are at risk for late onset complications, arrhythmias, heart failure, and even sudden cardiac death. So one of the things that we've done at our own adult congenital program, we've implemented what's called a transition clinic for our teenage patients to really educate our teenagers and, more importantly, their parents about the importance of lifelong care, empowering our teenage patients to take over the ownership of their own care. And really the goal of a transition clinic is to prevent that loss of follow-up and keep our patients going on and coming back for routine care throughout their entire lifetime.
If you want to learn more, there's an upcoming conference, I'm understanding.
There is.
Yeah.
We are having a regional adult congenital heart disease meeting on May 2nd. And this is a program that's put on together by Helen DeVos Children's Hospital in partnership with the Adult Congenital Heart Association. And the whole purpose of this program is for patients, their family, friends of patients with adult congenital heart disease, and medical professionals to really learn about specialized adult congenital follow-up.
You probably have someone watching right now that probably just nudged their spouse and said, Did you listen to what he just said? We need to follow up with you.
I hope so.
Absolutely. Well, thanks so much for stopping by. I appreciate it. Congenital Heart Center is located at 25 Michigan Street, Suite 4100. That's right here in Grand Rapids at 49503 is the zip code. If you want to learn more, give them a call, and you can go to spectrumhealth.org/ACHD. Thanks so much for stopping by.
Thank you.